Hello everyone, today's topic is chickenpox. Chickenpox, also known as varicella, is a highly contagious viral infection caused by the varicella zoster virus, which is part of the herpes virus family. It is most common in children, but can also occur in adults, often with more severe symptoms. Chickenpox spreads through airborne droplets. When an infected person coughs, sneezes, or talks, the virus can be inhaled by others. Direct contact, touching the fluid from the blisters or the sores, contaminated surfaces. The virus can survive on surfaces and spread through contact with these surfaces. Causes. A virus causes chickenpox. Viruses spread when a person with a virus gives it to another person, either through bodily fluid or bodily contact. The virus is contagious from 1-2 days before the rash appears and until all the blisters have crusted over. Symptoms. Initial symptoms: fever, headache, tiredness, abdominal pain, and loss of appetite. Rash. A red, itchy rash starts as small spots that develop into fluid-filled blisters. The rash typically begins on the face, chest, and back before spreading to other parts of the body. Progression. The blisters eventually burst and form scabs, which is when the risk of spreading the virus decreases. Duration. The illness generally lasts about 7-10 days. For most people, chickenpox is mild and can be treated at home with symptomatic care. Pain relievers like acetaminophen to reduce fever and pain, calamine lotion or other anti-itch creams to relieve itching, oatmeal baths to soothe irritated skin, hydration and rest to help the body recover. In more severe cases, especially for adults or people with weakened immune systems, antiviral medications might be prescribed. The chickenpox vaccine is a highly effective way to prevent the disease. The vaccine is recommended for children and adults who haven't had chickenpox before. Vaccination not only reduces the risk of getting the disease, but also lessens the severity if someone does get infected after vaccination. It's recommended that children aged between 12 months and 14 years get a second dose of varicella vaccine. This is not included in the National Immunization Program schedule. A second dose gives extra protection against chickenpox. While most people recover from chickenpox without complications, there are some risks. Chickenpox in adults tends to be more severe, with a higher risk of complications like pneumonia. Chickenpox can be dangerous for pregnant women and may cause birth defects or complications for the baby. Women who have chickenpox for the first time during pregnancy are more likely to develop a serious illness and complications. If you catch chickenpox while pregnant, your baby may be born with severe chickenpox, congenital disorders. If you are planning a pregnancy, see your doctor for advice about preconception screening for immunity to chickenpox. The chickenpox vaccine is not advised during pregnancy, so it's better to get the vaccine before you get pregnant. Complications can include bacterial infections of the skin, pneumonia, encephalitis, Ray's syndrome, especially in children who take aspirin during the illness. After a person recovers from chickenpox, the virus remains dormant in the body. Later in life, the virus can reactivate and cause shingles, a painful rash that often appears in one side of the body. Chickenpox is typically mild in children, but can be more severe in adults and people with weakened immune systems. The disease is highly contagious, so people with chickenpox should stay home until all blisters have crusted over to avoid spreading the virus. The chickenpox vaccine is a key preventive measure and can help prevent serious complications. In conclusion, chickenpox is a common childhood illness, but with vaccination and proper care, it can be prevented and treated effectively. While it is usually mild in children, adults, and people with certain health conditions should be aware of the potential risks and seek medical advice if needed. Be healthy. Bye.